We move straight away to leaders' questions, understanding order 36. Deputy Mary Lou McDonald, are you going to introduce some of the Christmas spirit today, Deputy McDonald?
Well, I've dressed for the occasion in red, Count Court. I thought it would be a bit much to don the beard and the hat, so I left that. Although I might get a more positive response from one Taoiseach if I was attired in that manner. In any event, in advance, happy Christmas to all. Taoiseach, I want to raise with you your government's management of the COVID booster rollout. This morning on your way to Cabinet, you said it's now a case of all hands on deck because of the Omicron variant. But I have to say your urgency comes late in the day. The truth is that we needed an all hands on deck approach over 2 months ago, long before the emergence of the Omicron variant, because at that stage we knew that we were facing into a difficult winter. And we've known for quite some time that an efficient booster rollout would be needed in order to protect people and to safeguard our progress. The fact is that government's lack of forward planning has led to real issues with the rollout of the booster. We've seen problems with the alignment of the booking system between the HSE, GPs and pharmacies. This means that people have received multiple appointments which stay on the system even when people try to cancel. One person has reported receiving 9 appointments, being declared a no-show for each one, despite no longer living in the state, and there have been many instances of people receiving up to 5 appointments. So I'm glad to hear that this is being updated, but it is late in the day. The lack of government planning has also hit the number of vaccinators that we have. We are down 500 vaccinators since the summer, which means the booster campaign is now operating at 2/3 of the capacity of the original rollout. So how has this happened, Taoiseach? Clearly, government made no contingencies for maintaining capacity in the vaccination network, and I think that is madness. We shouldn't now be facing the need to scramble for vaccinators again. That capacity should have been hardwired into the system. 2 years on, and there is still a lack of preparation and leadership from government, and that's why we see winding queues and big delays outside vaccination centres. It's why some people have been turned away from the centres. It's why we are now in a rush to get out doses that are close to expiring. We shouldn't be in this position, Taoiseach. All of the evidence reflects that the vast majority of people want their booster. The problem that we have is a government that moves far too slowly and is always playing catch up. We see it when it came to the use of antigen tests, we saw it when it came to the ventilation of our schools, and we see it now again with this booster campaign. A Taoiseach, tá an rialtas ag bug a róháil an fiachtas chandálóg. Tá an tam le haig fógraí mór hart, tá sé thar inis chun dul in leicleis, tá sé thar na hacfaní a chur fáil atá ag tastáil chun gnáróí leis an rulla amach. Taoiseach, you say it's all hands on deck, but the time for big announcements and big targets is over. It's now time for delivery. You say that you will ramp up the number of vaccinators. Can you tell us by how many? Can you tell us when they will be in place? Can you tell us what additional supports will be given to GPs and pharmacies? And Taoiseach, can you guarantee that the problems experienced with the appointment system will not be repeated as the campaign is accelerated?
Thank you very much, Deputy.
Opportunities wishing all the deputies opposite a very happy Christmas. I think I'm off to the European Union Council meeting tomorrow, so I may not get the opportunity tomorrow. And to you, Count Corley, as well, and thank you for all your facilitation during the year and your tolerance and patience, and hope it can last another day or another session, and to all the ushers and the captain and the team here in the House for your cooperation and guidance during a very difficult situation in relation to COVID-19. I also want to start by saying, in response to Deputy McDonald's questions, I actually want to thank everybody involved in the vaccination programme, and I want to pay tribute to those who have led it from the beginning, one of the most successful in the world in terms of the primary doses 1 and 2, which has given very significant protection to the population against severe disease and severe illness. I want to thank the general practitioners in respect of the booster campaign. GPs have moved very quickly from the outset in respect to the older age cohorts and those with underlying conditions, and with healthcare workers, to pharmacists, to the vaccinators across all the different centres. And just to make the point again, of course, that the vaccine booster programme commenced on the 4th of October, following advice from NIAC. The National Immunisation Advisory Committee advised to go ahead in advance of that. We are currently 4th in Europe in terms of the administration of the booster, thanks to the efforts of all involved. And the the arrival of the Omicron variant does lend considerable urgency to this, given the rapidity at which it spreads, and it's been designated a variant of concern for about 3 weeks. We've been in touch with our public health officials, with the CMO. They are concerned. ECDC is concerned at the rapid spread of Omicron, that it has a very significant advantage over Delta in terms of its infectiousness. And that is a concern. But be in no doubt that over the last number of days, we have been working with HSE and with public officials in terms of expanding further and extending further the vaccination programme. There are 3 essential channels. There are the vaccination centres, the GPs and the pharmacies. And discussions have been underway with the IMO and with the GPs, for example, in terms of being able to do more, if possible at all, from GPs across the length and breadth of the country who have done, to be fair to them, a fair degree of vaccination in the booster campaign so far. But those engagements have been taking place. There's a general good response. The primary care system want to respond, want to be of assistance to the country at this particular juncture with the arrival of the new variant. We do know that the booster does give additional protection, very significant additional protection against the Omicron. That's the general view of public health and the expertise, that it will give cellular immunity against Omicron. That's the general view and belief out there right now in terms of severe disease and in terms of admissions to hospitals, which is the key agenda and objective of the booster vaccination programme. And there were some operational systems issues around, but that they were not, in my view, we have to look at this in balance and perspective. They were not the key issue. And I think the key issue, obviously, now is to get as many people vaccinated as quickly as we possibly can. And that means extending the hours in terms of the vaccination centres and getting more expansion again in terms of the other 2 channels, utilisation of our primary care system through GPs and through pharmacies. Just to say that we're going to utilise all capacity at our disposal. I think we have 1.25 million now doses administered between 3rd dose and the booster, which gives the vital older age cohorts significant protection in the time ahead.
Well, the Taoiseach doesn't have to convince anybody in this House or beyond in respect of the booster. I mean, all of the evidence is that people wish to receive their booster. We have a highly vaccinated population. So therefore, the issues that arise, Taoiseach, are operational. There's a question mark over the management and leadership of your government in rolling out this booster campaign. We have had huge confusion, as I have said, in terms of appointments. We have had long queues. We have had people being sent away. And now we have a considerable volume of vaccine that will expire, that has to be administered to people who wish to get their booster. So I asked you a series of questions. We clearly need additional vaccinators. How many will we get, and when will they be in place? And what additional supports do you propose for GPs and pharmacists? It's clear that the government is attaching great importance and put in great stock by the booster campaign. So the issues of capacity are absolutely essential. It's not enough to thank those at the front line. We have to enable those at the front line to do their job and to deliver this. So could the Taoiseach, when he takes to a seat, tell us precisely, concretely, how many additional vaccinators, when will they be in place, and what supports for our GPs and pharmacists?
Could I say, maybe I was taken somewhat by what your colleague, Deputy First Minister Michelle O'Neill, said yesterday in Stormont, and I'll quote, if ever there was a time for a united front on the public health message, it's today, because we're facing into a very, very difficult period in the weeks ahead. That was Michelle O'Neill, and I would make that general point across the House. I think that is fair comment. But that said, in terms of a number of points you've raised, there's no issue with the Moderna vaccine. It's not been rushed out. I took Moderna myself on Friday. I waited in a queue, in a line. The mood was good. People talked to each other. Lots and lots of people are waiting in line, happy to get the booster vaccine. And I think there needs to be balance and perspective in the commentary around this. I mean, thousands and thousands were done last week. They lost a day with 2 days with Storm Barra. But you know, they had the highest day was last Thursday with 43,000 doses administered. And it is more complex than the first campaign because of the interval data was one issue, but also in terms of doing multiple age cohorts together, GPs doing it, the pharmacists and the VCs vaccinating the same patient cohorts at the same time. So it was done differently to the first phase, which brought in an additional layer, if you like, of complexity. But I think actually, genuinely across the country, yes, there will. I mean, sorry, as I said to you earlier, we're working through the 3 channels in terms of additional output, if we can, from the GP side,
over time,
from the pharmacies, and extending the hours of the vaccination centres, plus the acute hospital system have been told as well and have been engaged with in terms of reducing some activities with a view to engaging with the vaccination programme.
You don't know how many, just say that.
So it's not that simple.
Deputy Shortall is next. Thank you, deputies. Thanks.